all the baby where don't poke me at, where don't make me feel like say I'm not man enough. I no get nothing for offer. So only party when look down.
Hello, good evening, and welcome to another episode of your favorite talk show, the Talk to M Show, where they come to you every Tuesday 8 p.m. at Epic Radio on Epic Radio 99.3 FM. And thank you so much for supporting the show and being a part of the show. If you're listening to me on radio right now, thank you. If you're watching me on Facebook Live, also I'm grateful for you tuning in. Thank you so much for supporting the show, because so many things that go on right now, but you decide for tune in and watch me on Facebook Live, or you tune into the dial. I really appreciate you. Thank you so much for supporting the show. And today we get an amazing show for you. I am your host, as usual, Mulku Sulaiman Bangura. And if this is the first time you are listening to this show, we designed this show as a coaching and mentoring show, a show that promises to help young Sierra Leoneans, just figure out this thing called life and travel, this path without no GPS called life. And that's what we do here in the show. So today I have a special guest. And of course, if you've been listening to the show, you should already know that we are on the topic of drugs. We don't talk about drugs, and we don't talk about how we don't do comparisons. There we, at least at some point, the last two shows that compare synthetic drugs and plant-based medicines, and we deal heavily into plant-based medicine, with medicine, and we deal heavily into synthetic drugs as well. But it come off from a non-professional point of view, and as I be saying, me not a medical doctor, so my view was solely based on research, and research, I mean Google, AI, ChatGPT, and that's exactly what it is. And also podcasts, listening to people and getting their own experiences, and slight readings where I do, and articles that where I consult. And that was how I come up with this whole topics how I handle them last 2 weeks. But today the show I decided for bringing in a professional, and somebody who can talk about some of the things there from the medical side of view, a medical practitioner. We don't they practice for years now. And but when I come back, we can take a short break. When I come back, I go introduce my guest, and I go set the intentions, and then we go continue the conversation. See you.
Come up today, tomorrow, next tomorrow. The story not just the same, but I refuse to give up. I kept on hoping, I kept believing. Now everything don't change. Me wanna see me life now. It don't get tired now. Famous standing them now. You know the beat say you don't know me now. Anytime I like a fly to Dubai now. Hey, with me baby now. Anything I like now they buy now. Turn down, cause me I let it turn down. I let it run down. I'm looking forward to a brighter future. I'm moving ahead. I never stop for nothing. I'm looking forward to a brighter future. I'm moving ahead. I never stop for nothing. For this one where we there, people go come inside you life. Some go come for stay, and some go come and go. The reason why someone go stay, now only God know. The reason why someone go go, now God himself know. Me brother, me I don't go regret. If you decide for go, it's happened for a reason. Now only God know. What you get for no say, it's never the end. Cause the downfall of the man no, not to the end of the life. And then they give up, and then they turn down.
All right, so welcome back again. We don't come back. If you just joining, this is your favorite talk show. We come to you every Tuesday 8 p.m. on Epic Radio 99.3 FM. And me now your host, Mulku Sulaiman Bangura, and your favorite talk show, the Talk to M show. As you are aware, we don't talk about so many things in the show, and we don't handle, so many things. And we design the show for help young people, for figure this thing called life. We don't talk about entrepreneurship. We don't talk about applying for scholarships. We don't talk about applying for fellowships. We don't talk about career choices. Now we go into some of the dicey issues that were in drugs, and apparently, they ravage this country. But we they handle them, very cleverly. One for be very careful as we go about them. But one for give you enough information where you go arm yourself with, so that you can make, constructive decisions, and why some of them drugs are harmful to you, why some of them drugs here can lead to your early death, how then drugs here they actually kill and destroy the society as a whole, how the workforce are affected, how some of them drugs here don't cause social instability, how then drugs here don't destroy families. And I need to talk about kush. We need to talk about kush at this point in time. This will talk about actual some of the synthetic drugs that they are actually accessible to people within design and be prescribed also from or by a doctor. So today, for can help me scatter this conversation, I get with me a friend, somebody I know for over 25 years. We don't come far, played basketball together, the same basketball team. The Atlantic Dolphins, shout out to the Atlantic Dolphins. We play in a national stadium, we play national competitions together. And then, he has been a very positive intellectual friend who I don't know for why, all these years. And apparently, he's a medical doctor professionally as well, and I done in the field for over 20 years, 10 years, right? Over 10, 15 years now, if I'm not mistaken. Yeah. So, and he's been doing this for a while, and he don't hold several positions, and he's a highly trained professional, but he can't tell we, all about himself and his journey shortly before we go deeper into, the topic on hand. So, ladies and gentlemen, please welcome Dr. Koeyodoma, Songor Koeyodoma.
Good evening, ladies and gentlemen. Viewers on Facebook and the listening audience. So, good evening. I need Songor, pull it up because it's me, you know, ever get that kind of doctor thing.
No, I know.
Anyway.
I professionally. So,
it's okay.
Yes.
Well, professionally, except for like me, Dr. Koeyodoma, but on a normal basis, Songor is mine.
Of course. So, thank you so much for joining.
You're welcome.
Songor.
You're welcome.
It's a pleasure having you here. So, like I say, I don't do the introduction. So, basically, we talk about, we handle synthetic drugs and plant-based medicine. We just look at the correlation and how some of them synthetic drugs here don't they ravage the country. But before we go deeply into it, who is Songor Koeyodoma? Tell me a little bit about yourself.
All right. I think me and that kind of quiet person. We want for the shadows always.
Yeah.
Well, by nature, most people can say me nature only allow me for be quiet, but it's my desire, my dream for the quietly and do it that they do without causing too much people. So, well, of course, you know the Lady Foundation, me a medical doctor, and I done the practice for. I graduated in 2014 and done medical school and do my housemanship and don't travel 1 10 to 10 go try for do some postgraduate courses and so as of now I go proudly for say me what you call a clinical epidemiologist. I'm into research. I'm into if you see somebody sick, one person sick, you see 10 people in sick and 20 people in sick. My job will be to know why, how the pattern they, and which you can use for know how 10 people go sick in a one small tongue, how on a go know that day, and you can able go an influence, you can able profile a solution or a plan based on the available data that they will get. And for me, my decisions are purely based on data. So and they drive me forward. And you know when you reach out concerning the fact that you want to discuss this thing, it's the silent epidemic nobody wants to talk about. Normally ignore the conversation. Then they put on that quote say it's a Gen Z thing. But it is much more scary than with the one that one for even perceive them.
I'm sure.
It is very, very scary.
I'm sure.
And finally, currently when I come to Ghana, I go to my MPhil in applied epidemiology in the University of Ghana.
Okay.
I come back and I was privileged enough to be part of a transition team for support the National Emergency Medical Service. I mean, as I tell you, data was not in our favor, so we were brought in to have a review and get a facelift and try to see how much we can make them better, improve on the services, reduce returnaround time. Let somebody get access to ambulances, but today's not ambulance, so we're not going to talk about that.
Of course, so we'll find one fine time.
Yes,
we'll talk about that.
We will.
Yeah.
So, and it's everything where they go on. The fact that we don't start the conversation, or you don't start the conversation, it's a very, very good thing. I hope say the one day we the lead in various spheres, then be able take a leaf from this conversation and broaden it, because this current generation is under severe threat.
But they can't talk deeply into this.
Severely under threat.
For me, people, the way they look at you, a young boy, a young girl, because that's exactly why I do this show. Let's say somebody there from 3 now, or a girl instead of SSS 9, they think about what if we do. This question might inspire her, like why you chose medicine, why you become a medical doctor.
I forgot what I used to go print of.
I know. You go on my face. I deliberately not talk to. I don't single piece of it.
On the mind we bring in the lion, but I mean, why? So I come from a very humble background. My daddy, I be a teacher, and therefore a politician, and my mom was a nurse.
Okay.
That first-hand experience of spending more time in the hospital, and then with time, I began to nurse a desire for make a change, and unlike this generation now, we own generation. Remember, I say we're not traumatized generation. We face war, we saw killing, we were displaced, we were, we were traumatized, or we are traumatized, and then be really give you a sense of how can I make a difference? How can I save life? How can I? I mean, the body was like you say, we run the car, we see 35 person will die. Supposedly done. We're gonna Connaught Hospital, Cottage Hospital, come all the way all the way stadium. When you see these things and you ask, say, how can I help? So that day I been asked the things. If I go to but they always say, you can't tell lawyer, you go to lawyer. But for me, I don't think say law not been something will affect me that much. I don't see injustice. I just see people suffering. And that desire, they push me. Of course, I go Prince of Wales, the best school. And
Lord.
Then I be senior next back. Then
stay look at my school.
Please. But the most, so then I go medical school, done medical school, do me MPH, go do MPhil. So I mean, for me, in fact, I think even one of the reasons why I choose to go into public health, because I think I will make much more difference to a greater number of people compared to be a clinician. I'm not saying the clinicians are wrong. The fact that the people I solely admire, the surgeons, the physicians. But when it comes to making decisions where they affect 20, 30,
multiple people,
100 people, it's much more than seeing patients one at a time. So that's why that's nice. As I tell you, one for see and make as much help as I can to as much people as I can. That is my cue.
Okay. Did you have a mentor, like somebody we look up to? Say,
I think I when I late in that regard, when I late bloom, I get a mentor very, very late in life. Very, very recently.
So the full inspiration was just.
So it was just me with God, my mom and dad pushing me. But I get
that's amazing.
And now one thing where I think we'll push onto you can talk about mentorship, because mentorship plays a very strong role.
Absolutely.
In the development of anybody, and most people ignore them. They ignore them. And when you get now, like we light fire in a bush. Now, so we all day without mentorship. But like we the world, we the concentrate all the heat.
Exactly.
That is what you are when you have been mentored. Because then you full potential the show. You full unbedled potential the show. Because when you in a fire, that's the bush burn all kind of thing. But you need the burn pan, you need the burn metal, you need the burn nail. But when you weld, when you don't put all your energy, you don't harness into one small thing, you the boss metals, you join metal.
Absolutely.
So that's for me. That's how me see mentorship.
Okay.
And the significance it play on anybody in life. And for me, in a very short time, I got a mentor. You go say I can't like body that kind of thing. But I think mentorship is much more than that.
Oh, beyond that.
You get a person
way beyond that.
I'm sorry. When they look you ping in and tell you say this is wrong.
Yes. Somebody really hold you accountable.
Yes, that's the word. Accountable. And tell you say I know you can do it, but you can be better. Than this, and you can go farther than this. You can jump higher. You can go longer.
Because if somebody really admire, and then that person they hold you accountable, you feel obligated.
Yes, in fact, you didn't even lie to us because you feel say when you honest to them, you feel obligated for being honest
exactly
to them, and then they help you be better person.
Absolutely.
Most people they can privilege forget like a daddy or a mother where to mentor them from that kind of thing in life, but
not everybody get
a privilege.
Access to,
like me and daddy wants to be a doctor or something,
exactly.
or only you can get mentorship from different aspects.
From different, exactly.
Yes, but in my career pathway, I mean, I've just been going like we find this
self-motivation.
So now I don't get like a mentorship. Like, okay, what's your 5-year plan? What's your 10-year plan? How can you achieve 5 years?
Okay.
Stay humble, stay low, stay below the radar. Don't show to yourself too much. Build on yourself, develop yourself. Then I have tips and they keeps you going.
Absolutely.
So which is why I would say mentorship is something you must also take about and talk about.
Oh yeah, absolutely. I always talk about mentorship in my show. It's a big deal. We had like 3 months or 4 months just talking about it, talking about career choices and mentorship. So let's start easing into the topic on hand. What's your opinion about plant-based medicines? What will be small? I remember when Umamabi they go, they sell this bangba. Sometimes you can go na bush where you seek malaria, then put on and so can find, then put on water, and put on some kind of place where humid, so you get enough heat after 2-3 days, then take on the income. I mean, that's just the simplistic example of a plant-based medicine where they can give you the income. With income, it will prevent you from getting malaria, or it will bitter your blood in terms of that kind of thing. That's just an example. In the simplified, I think I oversimplify, but waiting at you from a medical standpoint of view, what's your opinion about plant-based medicines in general?
So for me, it's a very interesting conversation, because when you get for talk about medicine. Mostly, especially drugs.
Yes.
Mostly they come up from nature.
Yes.
Natural things. For example, that bangba we talk about and you get key components there where they treat malaria. Another components there from that plant-based day. That then harness that component there, and within pharmaceutical company then go replicate or then like that kind of thing, that compound there. They study the compound. They replicate them. Them synthetically manufacture them. They make them fine, then package them well. They sell them to you as 2 or 3 tablets or 4 tablets, as the case may be, for any kind of malaria you take for treat malaria. With the same effect with that bangba they give at the same effect that medicine they give, because that thing where they mend the malaria with the inside that bangba with inside that bangba 9 and take then convert to medicine. So
it's something we're not opposed to.
Definitely not. Definitely not.
Okay.
No. In fact, I think they get various sub-disciplines inside pharmacy, like pharmacognosy or something. We get to do with purely plant-based. And then we get Salome get one doctor. We can get a kind of background there. And when you go to Ghana, you go to other countries within the practice traditional medicines. For example, they get like in Kolibu, for example, they get a whole section where probably purely traditional.
Wow. So they just research on all traditional medicines.
Purely plant-based.
Wow.
In fact, Ghana they get their own local economy when then they do the extraction from the plant, they manufacture and then they make it readily available. It is there, amazing. And there are people who believe for taken because there's an assumption say we can be right. I know I stand to be corrected. Yeah. Say you get less toxins or less bad thing them pass that makes the way you go buy na pharmacy
with chemically
because then they don't go through a lot of chemical process there. And so and even now you take food for example, then we process them for example, or then them animal agricultural system. Then if you get farm, people in who prefer then grow organic things then for feed them. If you fish farming right now, you take them, fly them, you grow them, then the maggots you take for fish, it's much more healthier to the fish than you go buy imported fish feed. Because then a synthetic version of the original one. And you see now the effect. When you begin put synthetic things then you genetically modify so many components. So that make me when I fan of medicine in any form or shape, but I like also traditional plant-based traditional medicine. Of course.
So I think the general consensus, where I'm sure it's shared by most medical practitioners and professionals, not the fact say no more, because that's what the big pharma they focus on. Say people can use it, they can easily overdose because you don't know which dosage will fit you. Like for instance, how much of that cup you need for take for your body go take and handle for mending malaria. That's what the argument is. But the argument also is, even for these synthetic drugs they prescribe to you, people still abuse them. People still take beyond what's in their body they take. So that argument basically negates itself, where you look at how people they access synthetic drugs and also abuse them. So I just throw that out there as well.
I think you're right. You so for me, well, because the long book now, don't begin make like say some be all now they begin. You know that's that kind of thing.
I know.
First time where you get malaria. Then they all you and they all you foods, then quiz you jaw, you open your mouth and take the bang bang.
That's what I
after one day, two, you don't feel better. Now you go begin ask. Now in fact now we first in a cloak we will take now. Because of so many modifications and so many resistance developing. So we don't begin go now to you can see all kind of
Malfan now, all
kind of that. Now you don't get it. NEMS or mal, what's in denk mal, asudenk, all kind of TDA. So for me, it's fine. One we get advancement in care. But don't also forget say the more we they go up before, the more we exposed to things that way bad.
Absolutely.
And the more, because what's in the happen like that, what the pharmacy does is na profit one.
Oh yeah.
So they add any other thing for maximizing profit.
Yeah, absolutely.
For example, if you say 1 gram of this, it go try for break and down to 1 nanogram.
Yeah.
As long as you can concern in profit, and in profit can also affect people. I mean, most people can always get effects of drugs.
That's it. So let's go into psychedelics a bit, because NSF also fall under plant-based medicines. So based on research and based on talking to people, listening to people, there are certain conditions in the way people in the struggle, like especially mental illness, PTSDs. People they struggle with certain traumas. People are schizophrenic. People just get this kind of mental challenge where medicines, natural synthetic medicines, they actually usually resolve the problem. Perhaps it puts them in a state for just reduce them, and the condition. But some people they go into psychedelic drugs, and witness some of them psychedelic drugs. For example, mushrooms. They will take mushrooms and for just help them calm them down. Do you think psychedelic drugs very harmful, to the body and the brain as you know it?
Them drugs that we get for do with things them of the brain. I can advise the people let them treat her with extreme caution. Because against the way we talk to this, what they call psychedelics, they want that kind of thing. Like some kind, I'm not going to call and say it affect cure. No. There are tools where they augment for let you manage mental challenges them.
Okay.
And where they give them out, or the way they administer them. If you administer them in specific environment, controlled environment. Because when you do that, then they call psychotherapy. When you do them, you get some kind heightened sense of treatment being achieved. So they just gear no more so.
Okay.
I make an advice say, well, you give them the drugs and psychedelic agents them. Like you go to a MDMA, you go to a psilocybin, you give them with specific prescription. Those are what you call specialist drugs.
Okay.
People yes, I tell you say we are all are traumatic people in this country.
Absolutely.
Especially we in generation, we face war and everything. I can sometimes if I like tire, bang, and it gets my sister, if you ain't gunshot to get fever, my younger sister. So what that does is we are at some point having been exposed, being traumatized. You visit person, they sleep with the grinding teeth, the grinding teeth, they sleep with the call. These are all ways for express fear, managing them, then kind of thing. So me not go rush for talk about thing the way I go advise. Let you try for create a platform you engage. The good thing is before we get Dr. Naomi one green.
No.
Now we get young
doctors.
And there's a new doctor one, Dr. Abiba to Kamara, I think so. We just don't pass in primary. So
that's good.
Yeah, so we get more doctors.
I go look at things if
yes, I go really.
I would love.
We they're very much specialists in mental health. Not something we. One Dr. Maybe was a quantity say all Chris man.
Yeah. I remember
the time we were
we were very angry about it.
We think say the one day we do dirty clothes or they run over the place and the case one. There are various forms. People suffer from depression. People suffer from anxiety.
When I didn't think the way they struggle with, then they struggle, then they look for solutions. People keep looking, searching for. You know why we know they see? One of the reasons in my opinion, I think, say we know they see. We know they take them too seriously in this country now because people are ashamed of saying, "Oh, I'm depressed." Because if you say now I'm depressed, or you don't even get the language for state exactly how it feel like, and then secondly, the space not in as you say you're depressed, we're all depressed in this country. Then they invalidate your feelings, and so. But there are people quietly struggling with these things, struggling with anxiety, struggling with panic attacks, struggling with all them things their way. Actually, there is no direct. Take a medication and you well. So people keep going for solutions like what you say so now for psychedelic drugs, or now it makes some man even they go into smoking cannabis, so that it will keep himself calm, relax, it puts himself at that state state. But not knowing that these things also get negative effect.
Mulku, I just interrupt you small. You see, I know it's not Dr. Naim now, but I don't say no more. I don't say no more. We all, as alone, they go through some kind of mental health challenge. The good thing is, I will tell you, Sierra Leoneans, we don't use that word, we are resilient. They're not war.
Yeah, true.
Imagine a country, we don't face war. Don't in a war for almost 10 years and above. We commodity, we get Ebola. We go through COVID camp. We go through mudslide. You commodity, you go through cholera. You commodity now na mpox donka.
They tell you.
So there's this continuous trauma we've been exposed to. Continuous trauma. Like one day we met some call me doctor and talk say even doctors in right now we need mental health support.
Absolutely.
Every day see person die. Every day it eats person. You think so when you go in a house, you go home as a happy person? No. You just to be strong no more. They go, they smile, they make 10 business.
Absolutely.
You carry loads of pressure with you.
Absolutely.
Lots of negative vibes, lots of trauma, lots of stress. For C5 people in the crisis, that is in itself traumatic.
I agree.
But because Salomon is resilient, you go no more. I can say, we continue for go back. We come back the next day.
Yeah, I know.
And with time, you develop some kind layer. You able process.
Yes.
You able express.
Yes.
You able even relate. You're not gonna know that pain again. You're not gonna know this. If you work with someone that can say, I think say closure.
Yeah.
Or allow yourself to heal. Those are very important things. That we are. If we possibly go to the gap, go back to man next week.
True. And grief not to tell you just
and no,
you just heal no more like that. Just 2 days, 3 days.
No. It involves much more than that.
Yes.
It involves you accepting first.
Yeah. So this is real.
And then begin make effort for seek help.
Yes.
Almost of we they accept that first.
Yeah. No. That makes some man go to say, oh, not to one day cry.
To one day cry.
But that's exactly, heal. So not to one day cry.
So you get for allow yourself. You have for allow yourself for grief.
Yes.
You have to.
Yes.
Because when and then thing they way that happen repeatedly.
You get numb to it.
You get numb to it.
Very bad.
And it's so bad. Now like like you know man, you slap your girlfriend today. Tomorrow you slap her back. You slap her back. They begin develop some kind. They can't slap me.
Yeah.
And that slap they get to a point now. You need to forget the slap. They expect the slap.
Yeah.
Then when the slap come, it go begin go beyond the slap. Say slap no more. Let's slap him out. You don't develop resistance to the slap.
Exactly.
Wait, that slap they and they say you slap us it's traumatic.
It's very traumatic. It's a very traumatic experience.
So Salon.
You're right. It's something I always want to talk about, but I'll be saying I keep them for me next. Should I make I go talk to that doctor? Mental health. There are people that where me personally in my own opinion, those people should have constant mental support. You see, police officers, especially the NCID officers, and the homicide investigators.
Yep.
Then one day they go.
You love the doctor there and the nurse there.
At the candy. Then one day they call where they go see them violent scene them. Crime scene them where they don't kill person. Then one day I'm telling you, they need to go home the same. Same thing with medical doctors. Imagine they see a life come, and then you know the doctor where they say time of death for somebody in life. They call time of death. That is something you cannot normalize. It's not normal because we are not actually built for the kind thing. So it's not normal. Even nurses, they care for person. Once a nurse care for somebody, they don't build a relationship.
Exactly. And then nurse then they get more relationship with the patient.
Then they get more relationship. Once you don't build like relationship, and then seeing that person they dying away, you don't get anything to do about it. It's not a normal thing. And those things we normalize or they act but you normal, you don't see it, you don't see better it, but it's actually affecting us and affecting our relationships with loved ones. Because now you get numb to a certain feeling where you can't express to your loved ones, and now your loved ones wonder why you did so.
Why you so?
Not understanding that you see horrible things every day.
You don't know how you date her. Like,
exactly.
How you take out that negative vibe,
that pain, that heaviness, and it acts for again medication with the teeth dandy.
In fact,
I'm not thinking
I think the culture is we've become so numb to it that we don't even know if we said in pain.
Exactly.
We don't go to hospital, see people and die.
Yes.
Okay.
It's not normal.
In fact, we move on. Like I lost my daddy like last year, August.
I remember.
That was the time I felt pain.
Yeah. I know.
I don't experience so much death and just me daddy die. I felt pain.
I can imagine.
So if imagine me practice almost 10 years plus 11 now, then somebody of all the years that one green death now he really touch home. It means all that shield one don't develop, it does crash.
Exactly.
My brother, it was not a good sign.
We get a tipping point. I remember forget you on phone was difficult. You were off social media. You were like
I feel my heart. So then pain, and if you don't start even up to now I'm still grieving. Sometimes I just put my father on my status. In my phone, that picture that it's for I don't know. I don't even know how to let go of it.
It's a process.
But as you say, what's the world get problem?
Yeah.
They see mention cannabis.
Yeah. So tell me, I want to take a short break, but that just talk slightly about cannabis. What you take on cannabis?
Well, you call it weed, you call it jaga, all kind of rap, everything.
Yeah.
It's a very dicey topic because one you get to do with. For me, I tell somebody, I say we own generation, we own taboo, not being jamba.
Yeah.
If they see you, they smoke jamba.
Yeah.
Outcast. Outcast. But now they want to smoke the jamba now.
Yeah.
They're relatively very, very normal. And trust me, as you mentioned, cannabis like the beginning of conversation are plant based.
Yeah, plant based.
Purely plant based.
Absolutely.
You extract, you plant your weed, the cannabis, you pluck off, you dry them, you crush them, whatever it is you do, you wrap it into your blood, your joint, or whatever you call them.
Yeah.
You smoke your weed.
Yeah.
And when you smoke them, it causes as a mental effect.
Yeah, of course.
It'll make you feel calm.
Yeah.
It'll make you feel hyper.
Exactly.
Depends on the individual. It makes some people, like you say, they meditate. You can be in some kind of trance.
Yeah. They hallucinate as well.
Hallucinate.
Yeah.
You sit in the way now you want to see.
Exactly.
You see the host they go around. You see the host they go upside down. Those are things that but it also gets some medical effects though.
Yes. I don't want
it can be used for manage chronic pain.
Yeah.
Yes, it can.
Yeah.
It can be used for manage epilepsy, anxiety. Some people take like asthma and take them. You get some bronchodilating effect. It make you breathe better.
Yeah.
You get some. They can say you get antihistamine properties. Whatever it is, they want to do, but it's plant based.
Yeah, it is.
The worst part is now they synthesizer now.
That's it. They pull the CBD,
they pull the
THC.
Fine.
Yes, they sell separately.
They create them. So my problem is. So these are my own issues now, and this generation now, and they see we own generation we've been smoke weed as old school. Now, the things that when they do.
Oh yes,
my brother.
Oh, yes. I mean, it just to usher into the next conversation. Well, I'll take a short break, and then when we come back, we can head straight into some of the substances there where people in the take.
Gets nothing for offer, so only party will look down on me. Where don't make me feel like say my life no go become something. And they walked away. All the people who promise for help me, they say come office today, tomorrow, next tomorrow. The story not just the same, but I refuse to give up. I kept on hoping, I kept believing. Now everything don't change. Me wanna see me life now. It don't get turned out. Famous and the name now. You know go fit say you don't know me now. Anytime I like a fly to Dubai now. Hey, with me baby now. Anything I like I they buy now. Turn up, cause me I let it turn down. And then they run down. I'm looking forward to a brighter future. I'm moving ahead. I never stop for nothing. I'm looking forward to a brighter future. I'm moving ahead. I never stop for nothing. For this one where we there, people go come inside you life. Some go come for stay, and some go come and go. The easy why someone go stay. Now only God know. The easy why someone go go. Now God himself know. Me brother, me I no go regret. If you decide for go, it's happen for a reason. Now only God know. What you get for no say. It's never the end. Cause the downfall of the man no. Not to the end of the life. And then they give up. And then they turn down. Every day and they turn up. See me color, it pop up. Famous and the name now. You know what say, you don't know me now. Now me son is glad at the party now. Even you baby, they call it now. Cause I me they make all man they glad now. You next on the beats now. The people just they grace, just they dance now. Hey, they just they dance now. They just they I'm looking forward to a brighter future. I'm moving ahead. I never stop for nothing. I'm looking forward.
Hello and welcome back again to your favorite talk show, the Talk to M show. We come to you every Tuesday, 8 p.m. on Epic Radio 99.3 FM. And me, your host, Mulku Sulaiman Bangura. And today with me, I get an amazing guest, Dr. Songor Koeyodoma. We don't talk about drugs, synthetic drugs, plant-based medicine as well, from the medical standpoint of view. If you just join me, welcome and thank you for joining the show. Thank you for watching on Facebook. Thank you for if you listen to me on radio as well. You can be a part of the conversation. You can call me on 079-994-993, or you can send a text message on 079-994-993 and be a part of the conversation. We go expect you call. We go expect you, your message, and let me hear from you. Let me get to your own perspective and how you see the conversation to go. Now, with the progress, to the second phase of the conversation. So, Dr. Songor, I think while we talk about now the synthetic drug will really ravage a lot of people, the way people in their abuse nowadays, we fall under the category of MDMA, we're not this Molly and ecstasy. I mean, we just don't talk about cannabis and how it's a plant-based medicine for sure, and we don't talk about the healing attributes them and what it's capable of doing. But this ecstasy, this Molly, we don't see them proliferate the market. They're all over the place now. How dangerous it be from the medical point of view on the lives of young people and their body and their brain as well?
You see, I don't think say this conversation for start with we. I think if we get a very way up to bottom conversation.
Okay.
This is threat. This is dangerous.
Wow.
Which I tell you, so you go don't hear him, you go don't see him, you go don't get an experience to him. Me like say we are old now. We are old people now. Trust me, we are. Because as I mentioned earlier on, the jamba will be in smoke. Old generation be they partaking. It don't become less now. I see I don't talk about push. Okay, we will push them back aside.
Yes.
But even this drug we they call this MDMA, when I'm methylene, in fact 3,4 methylene dioxymethamphetamine.
Yeah.
Now a synthetic product in its entirety.
Yeah. Entirely.
In fact, modify the amphetamine. They modify in such a way that you know they only manage pain when amphetamine in call used for manage pain, or we go call say a non-steroidal anti-inflammatory drug. No. It augment the release of certain key things them we
in your brain. Yes, the dopamine.
No, I can't there. When you don't call them that.
Yes, serotonin.
I want to try for make simplify to the point where most people don't go understand. Like for example, you go see Belle woman where they go through labor. If they feel pain, he go Allah, he go scream as he born that pikin dey. We then put that pikin in your hand, or you hear that pikin dey cry. All that pain we mean they go through, it disappear.
Yeah.
It is what you call feel good. They call it the feel good hormone. So it's like dopamine. So for example, when you don't release them, you feel calm.
Yes.
So unlike the pain where the amphetamine they try for manage, now you they feel good with this one. Sometimes then you they feel super.
Yeah.
Because one thing where they put is norepinephrine.
Yes, exactly.
Where they make you they feel like that thing that like we call the fright or fight hormone.
Yes.
If you eat pang na or then fag on or they can't choke somebody na, you they feel you eyes them,
Yes.
the people in the dilate. What's in that name? It means a different way for escape.
Yes.
If they feel so you get extra blood to your muscle them, your skeletal muscle. We go on for propel you for make you run or make you fat or box somebody. You know you must be dry.
Yes.
And we don't add all the things together inside one chemical substance. You brought a 90 generation people.
Yeah.
And then they eat like that and they eat granite.
Oh my God.
You go to a party, you go see person go dance from 7 o'clock evening 10. So say 5 o'clock. In one day they dance, in one day they listen to it. Now in one day go they shake it no more, they dance, they pull up. I mean they dance with the guy right now. They can't style it they pull right now. Or normal days you don't pull that kind of style.
I know.
If you take that, if you go, my brother, go to parties.
It's not normal.
The things that they do.
And this thing get negative effect.
The risk that they take.
Yeah.
In fact, it take away that way called risk assessment. You don't afraid nothing. You go on for do mommy and daddy business to 5 different
Exactly.
because you don't take away all your inhibition.
Yes.
You can't say no.
Exactly.
Somebody goes, oh, you no more, you do no more.
Yeah.
You do what you do to you.
Yeah.
You grab, you go.
Yeah.
It's as if nothing happened.
Yeah. The ability for make conscious judgment.
I say you can't say no.
Yeah.
Your inhibitory center is being shut down.
Yeah. Yeah.
Everything that does go no more. Log go dance, log go. Log go swim, log go. Log and drug in itself, it's poisonous.
I mean, goes without saying.
Somebody define poison and say it's a poison at the excess of anything. Too much sugar,
I totally agree.
poisonous.
Yeah.
Too much salt, poisonous.
Yeah.
Too much alcohol, poisonous. Too much fat,
Yeah.
poisonous.
Yeah. Yeah.
Too much enjoyment, poisonous.
Absolutely.
Too much speed when you drive motor,
Yes.
it's poisonous. It's risky.
Yeah. Yeah.
Too much cigarette, it's poisonous.
Yeah. Yeah.
And you know, look the example again. We they mention bangba,
Yeah.
a small rubber. We say today, when they go bangba in the field better now, they say no, law prescribe them, no give specific drug, no give. They begin speak about English.
Yeah.
It's not bad. We agree. But now the amount of money and ecstasy this generation they take. My brother is scary.
Yeah, we got a call with the kind side. Can I just answer this call quickly? Answer this person. That's the new phone. We got a call with the guy for answer this call, please. Oh, okay, good. The call. Please call. You can call back. We miss your call. Please, you can call back so that we go. The you from you. We look for you from you. Your own perspective. Yes, Doc. Please.
And the two way make this thing dangerous. One force, he unregulated.
Absolutely. Yeah. The person call back. Sorry, sir.
Oh, sorry.
Yes. Hello. Good evening. And this is the Talk to M show. You name it. Where you call from?
Yeah, good evening, Mr. Bangura. I demand with you. Christopher Bamba, back up to your last week's friend.
Okay, Christopher. Yes. Welcome. Thank you so much for calling. Yes.
Yeah, happy belated political independence.
Yeah, thank you. Yes, Christopher. Yes, please say make your point quick. Yes, you want 1 minute.
The last people I believe in your analysis, and then the side effects we talk about
Yes.
this marijuana. Like, we try for advice me to appellate and after I drop the call. So, like, from that last issue,
Okay.
the association cannot believe until now what the topic is.
That's good.
Don't avoid.
That's
then I
good.
put in separate tests. They can see and see one side we treat me can win and it is hard. Like what on left and so now from that time also now what they keep I don't really take like 5 spoons. I don't to come over there. And that's the only thing we have to be see right now. And then I get a friend, a close friend of mine where he don't use to this, he don't addicted from like it's every day happening things to her right now. Like between the next 40 to 60,000 years to spend for the day. Then he still can be satisfied. And then what did they affect and our observer for the past 6 years, for the past 6 months now that work with this one together and at place, if you get phone, if you delay the phone in an open space, the eyes can easily see. But you know if they watch from over 10 minutes, and then we sit up talk, we sit on conversation, actually talk more than like 3 to 4 minutes, and then if you turn around back to asking, if you make a recap, I didn't get it well. So like a little confused, I said, what did happen? And then in body the dream seriously, when he was not in job, the guy kind of body the way they admire as everything. But after getting the job, and then the persistently they go on drugs now, It has become deteriorated. It's not even admirable to look at him seriously.
Thank you so much, Christopher.
But like, when I start the conversation, I just come over for Cam.
Yeah,
I just record that because anything what I go tell them, I think listen Epic Radio and then if you get the educative advice from this Ali just now will take with the tools to see the good for you.
Thank you so much for your fire.
That's why I don't start them. I just record on a voice and then I just
okay, that will be fine. That will be good for you. That will be good. I think you need for stop. The doctor there, just the online or more. We will definitely talk about something like that. But thank you so far, and I pray you go help your friend for making himself stopping.
I thank you guys very much.
Thanks for calling us. Thank you. Yes, we will cancel, but it's exactly what we will talk about.
That is just one.
Yeah.
Secondly, that all gets direct effects on the central nervous system. Direct effects. Direct. You know, even like you can say no, get direct effects on that. And for me, when you take, as I mentioned, the serotonin, it make you feel happy.
Yeah.
You will see people.
Just a minute, sir. Sorry. Yeah. Yes. Hello. Your name and the call from, please.
Good evening. This is Napali at the call for Kamayama.
Yes, Pali.
Doctor, the topic so interesting.
Yes, sir.
The advice all na the fine.
Thank you so much, Pali. Thank you so much for calling.
The will be the take that I own at the measure of Bangba and other Africans have them. There or the poison also. Thank you.
But actually, we don't condemn traditional medicine or the poisonous. We not condemn them. We not condemn them. Bali. We not condemn, especially Gwangba. We just see no more, like not over abuse them. At least take them small for help with if you get malaria or something like that when they bother you. Yes.
If we push the idea, say. We think Bangba 1 gallon or 1 rubber na abuse of drug.
Yeah.
I wonder what you go tell the one that then drug then in fact now how you go know that the color they get different color, they get move, they get pink.
I'll tell you.
They get then cross sign, they get X, they get star. I was like, what is this?
Hello, say the call from, please. You name say the call from.
We come, Mr. AKCC.
Yes, Mr. AKCC.
Yes. See, people taking actually. Them picking and a bad man as a bad. I know what I think. When you take out too much, you see when you take out, it makes sense, and you take out too much, you do bad. You don't find what look for anything for self for try for make you stop something.
Okay. All right. Thank you so much for your comments.
It will bad, it will make you bad. And I tell you what, the unfortunate company do bad, you see, the feel say nothing style. Either you take them. When I start when you go. Put a level for the marketer, help for emulate the pattern, if you ever do something. On the health, you know, fine, you transfer. What if the marketer should have any beat how you do where the beat how you need this shop, left family, you sleep, you have the clap for and that's why they get Christmas money enjoy. It's not going to be down so. You know, back in tomorrow.
Yes.
If everybody see us, nobody say that here, just because the law is for take them, you go to the corner, you take them, you can, so you go for that. Like you talking and teacher, you talk, you go cost you, you go be kialala, not for advice them. We don't go along for control anything.
Yes, sir.
You see,
yes,
sir. People are not you are for years.
Yes.
Until you take for something.
Yes, sir. Thank you so much, sir. Yes, thank you so much for the comments.
Addicted to it.
Yes, thank you, sir.
Very much.
Thank you, sir. Yeah, I mean, when you talk about this central nervous system, it scared me small because that's something people don't talk about. And imagine your central nervous system, those drugs have that kind of effect on it. You actually tell yourself, say you won't die.
And
technically,
even that you serotonin, they make you feel happy. You get very small stores. So in case user, it depletes the store. So it reaches to a point, they feel like zombie, it numb.
Wow.
And then they feel happy again. It doesn't numb down, and that's and don't forget the most bad part when they call addiction.
Yes,
you are addicted to it. Now you don't develop a cycle now.
Exactly.
Exactly. When you don't know your body, not they switch you again. Pass you take them back, and they say Molly better pass Kush. Kush na they get some food. Molly they get some food. With Molly or the ecstasy, mostly for students them. Now, one of the key factors then for reduce or make you remember your memory.
Loss of
it
memory.
Increase memory loss.
Wow.
So if you don't enjoy Pasmak, you don't go enjoy Pasmak. All the one they will take, ask them what's yesterday. Ask them for specifics.
Yes.
Say who's call or close Songor be
Yeah, they won't give you specifics.
Who's kind of boots Mulku wear?
Absolutely.
They lose that memory.
Yeah.
Then they go to a state where
It
they are always hyper.
Yeah,
They're there. In fact, then they at a level if they can fetch anybody, they can choke anybody, they can talk any kind talk, they can get unprotected sex.
Absolutely.
And me brother, who don't reach this level, don't learn book, you don't get one masters, you don't do two masters, you don't marry, you don't get picking, you don't get home, you don't get job, you are going. What you do is for the fun of it now, passion. But on the side 16 to 22.
Oh, and at the secondary school.
There is no future. You don't begin for take drug.
Yeah.
You don't get addicted to them. You don't even go college it. And when you go college,
What you do there? Exactly.
and you don't continue this trajectory, then we won't begin blame government now.
Let's talk about tramadol. So that's the other thing we fall under the opioid category, right? Because we all know, say, these pain medications actually, they are supposed to be administered in a controlled environment. Like tramadol, so because of in work way they do for ease pain, it was designed, under that whole opioid category. So you get morphine, you get fentanyl, you get all this, but we don't see how it don't become the drug, especially for boy picking now, for tick. Then they mix out body.
Say talk with you for they use that for enhanced sex.
I'm telling you.
Me, I don't understand that part today. That part is not bonus.
This is what I don't get. Then they take tramadol, mix out body. I talk about how morbid if you mix alcohol and opioid. They're not supposed for now, like when you mix oil and water or you put fire and petrol, they're not supposed for blend. And then the person dies, say they don't poison them. It's the wrong chemical combination. You don't mix tramadol and vodka and alcohol. It doesn't work. But the question is, whose side did they get the tramadol here? The supply.
This thing is very emotional. I can always say this, talk anything we get for do with in fact the thing is really bad safe. And the neighbor could not treat.
Oh yes.
Because people make tons of money from it.
The informal market, they abuse this.
So pain medication, pain management. Generally, the control management.
Yes. It should
For
be.
example, if you begin get this is a general example. To what you will get. We begin feel you idiot. Now go jump. Go begin to put tramadol. Come back from the basic.
Yeah.
First of all, go sleep.
As basic as that.
Drink water, go sleep.
Yeah.
If it still persists, you take paracetamol. 2. We are like 1.
Yeah,
500 milligrams.
2. Yes. Yeah.
If the pain not go away, make your way go to hospital.
Yeah.
Go to investigation.
Yeah. Yeah.
You've been a malaria. Let them check your pressure. If they find out say maybe a malaria, then go treat you appropriately.
Yes.
If this pain not improve, you can go up small to ibuprofen or diclofenac. You see what's not going on.
The levels, yeah.
And if it still persists, you go seek better advice.
Yeah.
Some pain then they maybe not let's say headache. It can be nerve pains.
Yeah.
You get what you call neuromuscular drugs, neuronal drugs. For them pain the way and nerve pain them, you don't need for take other medication. They get specific drug them for treating pain then they.
Yeah.
But when you go seek care, they go prescribe them for you, you go take her. If now muscle pain you get, neuromuscular pain, now you will continue that diclofenac as I mentioned earlier on, ibuprofen, then get their own way. For them reach to that level where they begin mark tramadol or morphine.
Those are the highest level of
those are levels of medications we have to be very, very careful of because they get dependency and the tendency for addicts to them.
Yes.
Now I want to give them the same morphine drug at some point in Banam. Because when in Testol and during the Vietnamese War, most of the soldiers after the war and everything, they were dependent on it. And they become extreme, erratic, then quick for angry, quick for fat, quick for this, quick for that, all that thing. Eventually it affected them. So America may put a very tight control on that work. When the country this at the same time go do my business, it is put in their pocket.
I'm telling you.
They get the cut and small. You see, take 1, 2 cents a month. They go see take, and as you mentioned earlier on, this country people don't get mind. People don't get mind though. People that. For go add, you add Voodie back, para.
Yes.
Voodie na energy drink, caffeine.
I'm telling you.
Plus alcohol.
I'm telling you.
And then also get sugar back. When they enhance the caffeine and alcohol for go inside, finally inside the cell, fine one.
You put more pressure on your heart.
No, not left the heart first. Not go up. Not go up first. The caffeine will affect up.
I'm telling you.
New excited, you get cardiac effects. No, not left that. Not go up. Up the talk about
It's
you don't take away all. There is a thing called awareness. We see don't know. You know what's in there before you, what's in the right, what's in the left, what's in the back. You know, your sense of smell is high, is okay. You can discern touch. If I touch this here, you want me this, me I know. That is called awareness. When you begin taking them the opposite, your awareness is taken away from you.
Wow.
So this country,
it's fatal.
If person go take Tramadol for do my business. That means anything I do my business, Tramadol they take.
Yeah, exactly.
Eventually, you become addicted to it.
And you're not even doing it for the pleasure. Now you're just doing it like a race you go on.
And when you don't become addicted to them, the day when you don't get Tramadol, nothing they happen.
That exactly.
They begin call pastor and say, your family they don't with you, they don't put on by you, they don't whip on by you. People they don't. No, these are the realities of life.
You begin bother God.
You begin go to God. They go bind devil. They bind. You they forget that you don't do things them.
Yeah.
You don't break certain channels. They don't break certain pathways them.
Yeah. I mean, this conversation we can go on and on and on, but we don't. We will therefore definitely continue on them. You know, and we'll continue on another day where we will talk more about now the supply. We will talk about rehabilitation facilities, resources for help people, especially addicts them, for recover people who are not addicted into them. But that will be for another time. But Dr. Songor, which will be your last final word of advice for young people out there?
Caution. Let them be careful. Let we all be careful.
Yeah.
For we life na a journey. Not a destination. Not to some direction bang. No.
Yeah, I don't reach.
And I go on, let we take care of them because I'm one great weekend. Let we manage your life well. Even if you enjoy yourself, enjoy carefully, enjoy with caution.
Yeah.
Even when you drive with caution. People that if you for now, most of the young ones then they are dependent people. They rely on people for feed them, for provide for them.
Yeah.
So we can understand.
Yeah.
But then let me caution about that because one, where then daddy or the mama we're not for them forever pass on and then face the realities of life. I make them pull out music adulthood na scam. because they don't even know how to manage adulthood. They are stuck in a place where the realities of life don't hit them and they are not prepared for it. You think it's easy for me and you? If we don't learn the book, we don't get the paper there, we don't get the degree there, we still thrive. We still thrive with all the challenges them. We they make ends meet. You now we no learn book.
Nothing, you not sabi.
You not sabi nothing. You not prepare for it. You not get skill set. Then you go begin born picking there. You go to papa. You get woman that also depend on you. Nothing not there. And people are dying from deaths the way I want to touch this part, please before go.
Okay.
Some people they go then chilling them, dancing and you see them your man don't die. Poisoner. you dey self introspect witty and witty you don't take.
Oh no, we don't.
You go, you mix tramadol,
Yes.
you mix molly, you mix, you add small kush para, you mix small voodoo para, you mix all kind timber. You leave an industry sleep. In fact, you leave the boss, you die.
Yeah.
And the way it is now, they say, oh,
They don't poison.
her.
Forgetting that I ain't take her.
Oh,
I ain't take all
you
that
forget
chemical
all the things
combination.
them because you go there on your own.
Yeah.
Then you want voodoo, me I take voodoo, I push the voodoo, so I say give me water.
Yeah, simple.
It's my choice. So let them choose life with caution. I mean, last one.
I think I like that they choose life. That's a very powerful, statement. Choose life, because if you choose life, whatever you put inside body, you go watch it. I mean, the calls in the car inside thick and fast, but Tim done now. We don't wrap up the show. But like I say,
wrap up. Just give me one small time. I want for use this opportunity also for advocate and sensitize the people of. I mean, you fans them and everybody. Mpox is real.
True.
I got advice: if you get fever, you get rash, you feel some way the way you know they feel, go to the nearest healthcare center.
Okay.
Let them see, then do investigation, and then find out say you don't get her.
Okay.
Left for paper doctor Yusuf. Left for rub wojo by your body, charcoal by your body.
Is there any vaccine for it?
Yes, there are vaccines out. So, but I mean, that's not me to talk about it. Me don't tell me your vaccine because me not a 4-9 worker.
Okay.
But I also want for use this opportunity for advice, life, caution.
Yeah.
Avoid too much crowded place than they are now.
Yeah.
We don't get that kind of sickness around the pass.
Yeah.
Not all side for the go now.
No.
Not all mind for the church chef. Not all where you have to bind somebody. Worst case scenario, you bind the person. Let us see proud.
Yeah.
If you shake and go wash your hand back because I mean it's mostly transferred through touch.
Contagious, yes.
And the pictures that we're seeing, what we are seeing, it is not good. So please make we choose life.
Well, there you have it. Choose life. If you listen to the show, if you watch me, choose life, and Lord, be careful. Sorry, we're not going to answer our calls now, as we don't round up the show. But join me again next week, Tuesday. Same time, sharp 8 p.m. as we continue this conversation, and we go elevate this conversation. And let we continue for talk. We'll go talk to a voice court, but we not go tire because we want to let this young generation that they never can continue on, and they never can lead, can administer, and they never can become presidents, and they never legislate, and they never be the workforce. We don't want workforce where they're already badly broken. So we play our own role for help, elevate that conversation there. Thank you so much for being a part of the show. Thank you for listening. And you were called. Thank you for calling. Sorry, we're not going to answer your call now. Dr. Songor, thank you so much for being a guest, an amazing guest, and this conversation was very, 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 very enlightened. So thank you so much to DJ Wonder, and thank you to Abubakar, for helping putting the show together, and also with all my producers them all. Thank you guys, and until next week, Tuesday. Good night and have a great week.
Only God to know the reason why some man go. Now God himself know. Me brother, me I no go regrets.